Alexa TV presents in 3, 2, 1. Dateline Schools with your host, Terry Harrington.
This week on Dateline Schools, we're visiting the St. Clair County Health Department and learning how we can help keep this a healthy and safe community. And to tell us all about it, my special guest is the health director here at the health department, Dr. Annette Mercatante. And yesterday, you started telling us a little bit more details about the community health assessment that we're doing. How many people are you hoping to interview with this?
Well, we've really upped the number. We'd like to get upwards of 1,200 individual surveys completed. And the reason for that is we want to be able to regionalize the information. We'd like to understand the differences between health issues in the western part of the county versus the southern part of the county. And so those are the numbers we need to make those statistically accurate.
When do you hope to have this assessment wrapped up?
Well, we're in the field right now. Again, Northern Illinois University is calling with an area code of 815, and we will be in the field for as long as it takes to get those 1,200 numbers. We'll hopefully be wrapping things up in the early fall, which will allow us to scrub the data and do all the stuff we need to start putting pieces together and showing some summaries of the information.
Great. Now, obviously, you're going to be comparing this to things that happened in the past years. Any idea where you're looking at and what you're anticipating so far this year?
Well, we'll probably have a completed product, a report out. We're thinking January, early 17, but obviously as things come out, we can always release them earlier in pieces. And a lot of the questions do reflect both state and national behavioral risk factor survey questions, but we've also included some things on prescription drug abuse and illicit drug abuse. We've included some things on literacy, which that's a concern particularly in our community. And so I think we'll have some unique information, and we'll have some things that we can compare ourselves to other people with as well.
And then that helps you develop a 3 to 5 year plan as to what areas you're going to be tackling when that comes out, right?
Correct. The most important part of a community health assessment is that we do something with it. And in the past, we've always brought this information forward. Other people develop their own health needs, and off they go. This time, we'd really like to have a community-wide health improvement plan, acronym CHIP, but the improvement plan should be prioritize goals and actionable items and things that we can measure so we can, as a community, work together towards some of these common goals. So it's a community-wide health strategic plan, and that's really what we want to really work on. Once we have this component complete, we want all of our stakeholders to come together and start prioritizing some of these areas so that hopefully next year I can sit here and tell you that we're seeing some improvement in X, Y, and Z.
We'll be back with more tomorrow. For Dateline Schools, I'm Terry Harrington.